everyone, and thank you for joining us today. I'm Dr. Anushka Patchava, the Deputy Chief Medical Officer at Vitality. Clinically Speaking is our advisor series where we share regular videos and updates around the new clinical trends, clinical insights, clinical data, technology, and innovation within the healthcare space. Sometimes you hear from Vitality clinicians, and other times you hear from experts in their field. Today's episode is focused on the future of health insurance now, and I'll be speaking to Liz Ashall-Payne, who is the CEO of ORCHA. Before we start, let me hand over to Liz to introduce herself.
Thank you so much. It's a real pleasure to be here with you today. So as you said, my name's Liz Ashall-Payne and I'm the founding chief exec at ORCHA. ORCHA actually stands for the Organisation for the Review of Care and Health Applications. When we talk about apps, we're not just talking about apps on the app stores, we're talking about digital health at large, so web-based solutions, native apps, etc. And although our name stands for the words that I've just said, actually our mission isn't to review and approve. Our mission at ORCHA is to improve lives through digital health. And the biggest barrier to adoption is trust. And that trust isn't unfounded. So across the breadth of digital health technologies available to us, only 20% meet quality standards. And so we shouldn't be trusting everything that is presented to us. And so what ORCHA do is we review and approve digital health technologies for government bodies on a global scale. And then we provide access to the qualified digital health technologies through bespoke digital health libraries and pro licenses, which enable healthcare professionals to recommend the best tools to their patient via text message.
Could you share with me what you think the impact COVID-19 has had on digital health and healthcare and data technology within the healthcare ecosystem?
Yeah, I mean, it's been such a significant time for digital health. So pre-COVID, people were using digital health. Every day, pre-COVID, 4 million people would download a digital health technology. Almost instantaneously, at the point of the pandemic, having an impact on our life where we had to go into quarantine and stay at home, we saw a significant increase in the number of people downloading these technologies. So a 25% increase almost overnight. So we went from 4 million downloads to 5 million downloads, and that trend has continued. I think what's also been really interesting is tracking what people are downloading. And we've started to see a real shift towards people wanting to download healthcare technologies to support them to manage conditions and deal with issues such as mental health. You know, pre-COVID, people who were using digital health technologies were predominantly looking at fitness and wellness products. And what we've seen is a significant shift to people now using these technologies to look after themselves or people they care for. Again, because what we've been doing is we've been living in quarantine or staying at home, not wanting to necessarily get into healthcare environments. And the world of healthcare has much more moved to a digital first approach, which has both been generated by end users and patients and also by healthcare systems. And areas such as diagnostics, which haven't necessarily been open, are now able to utilise the opportunity in the world of digital health. So digital health is now able to take chunks out of the pathway. So for example, if you're referring somebody to dermatology for a query around skin cancer, there are brilliant products out there that can check those moles digitally through an app-based technology. There are also products out there that aren't safe that claim to be able to do that. So we need to make sure that people are able to know which tools actually do what they say they can do. So diagnostics, mental health, significant increase in people using technologies to be able to manage conditions. And then the final thing I just mentioned on the trends since COVID has been towards the end of last year, we saw significantly more people downloading products to deal with the symptoms of long COVID. This is our new long-term condition, and we saw huge increase in people searching around the symptoms of long COVID. Now, running concurrent, we've also seen new innovations coming to market to deal with this new long-term condition. And what's fascinating is at the moment, every day, between 30 to 40 new digital health technologies come into this marketplace. So we're really seeing innovators and companies responding to the need that's clearly there.
That's so insightful, Liz. And I think that 30 to 40 new a day and the role that ORCHA plays in ensuring those new developments and those new technologies are safe for our members and customers is so critical. I guess what are the challenges you face then as a business and the challenges you see in the digital health space as we come out of the pandemic and potentially return to normal life? And with reflecting on that, Liz, how much of the trends that you've seen during the pandemic do you think will stay?
So the biggest barriers to adoption, there are 5 big barriers to adoption actually, which I'm going to talk through. So the first is awareness. We have access currently to around about 375,000 digital health technologies. Most people didn't realise that that's how many products were out there. So awareness that these solutions even exist is pretty low, both amongst our communities, patient populations, and our healthcare professionals. So my background is a clinician, as is yours, and we're not trained in these tools. And so our awareness is quite limited on what's available out there. What tools can we now start to embed into care? So the first barrier is awareness. It's that simple. The second barrier is then access. Where do you go to find these solutions? So basically, if you can think of a health or care condition need, what I can tell you is that there will be a number of solutions that meet that need. Where do you go to find them? And you might think, well, I'll just go to the Apple App Store or Google Play and give it a go. Type in a word like dementia on the Apple App Store. Some days you get no results, other days you might get 2 or 3. When in fact there are over 6,000 products that could support somebody with dementia. So access at its most fundamental level is a real challenge. And then when you look at access, how do I find the right tool for me and my personal preferences and needs? So out of that 6,000 products that could support somebody with dementia, there's going to be a lot of different personal preferences and needs. So what is it specifically about that condition do I need support with, and what are my technical preferences? Do I have a hearing impairment? Do I have a visual impairment? So accessing the right tool for you is also a challenge. And then once you access these tools, the next biggest barrier, which I've already touched on, is trust. How do you then trust that this product is actually going to do what it says it can do? And our research, as I mentioned, has found that only 20% meet that quality criteria. And so you're more likely to find an unsafe, unregulated product than a safe one. So that trust issue is not unfounded. And then the fourth barrier is then ongoing compliance and governance. So these digital health solutions change all the time. They respond to user feedback, which is fantastic, but that introduces a new risk. So another barrier to adoption is how do we manage and mitigate that risk? And that's a big challenge, particularly for healthcare professionals who are recommending solutions. So if I'm going to recommend a solution to my patient, I want to know if it's good today, but I want to know if it stays good tomorrow, next year, and the year after. And then the fifth big barrier is who pays for these solutions. You know, we have seen a digital divide, which has been much more stark during COVID. And what we don't want to incorporate is a two-tier system where people who can afford to pay for these solutions pay for them, and those who can't won't. And so who pays for these solutions? In the same way that we have national tariffs for prescription of drugs, you know, my question is, should we not be moving to that for the prescription of digital health? And you asked me another question, and I can't remember what it was after telling you the barriers. Sorry, just remind me.
It was how long do you think these trends are going to stick about post COVID?
Yeah, remembered now. So I think that they're here to stay. The feedback from people, patients, healthcare professionals is extremely positive. So across our systems of digital health libraries and prescription of digital health tools, we've seen an increase of 6,500% more recommendations going through that system. And then when we look to other jurisdictions, for example, we also work in New Zealand. New Zealand had a very limited time in lockdown, but what they've seen is that digital health has continued to grow momentum and continue to stay. So I think that we're going to see a significant increase, further increase in the adoption, because people have now experienced that. They want it. Now, that isn't to say that it's for everybody. It isn't for everybody. Some people will always prefer face-to-face and will always, in some instances, need that face-to-face contact. But what digital does is it allows us to deploy solutions to the people who do want that, and then that releases time to care for the people who want that face-to-face consultation. So I think that a blended approach is where we're headed.
It's really great to hear, Liz. It sounds like the most effective and efficient way to deliver healthcare services, particularly in the UK market. I guess with the changing landscape in digital health, the introduction of new technologies like artificial intelligence, the use of VR and AR now in the surgical fields and more in non-gaming entities and environments, what do you see the future of healthcare being like?
So I think that the future of healthcare is actually almost here. As I said before, healthcare professionals are recommending more digital health technologies than ever before. More people are downloading digital health technologies and bringing their phone into the doctor's office saying, I'm using this, look at my data. I think that there is a way to go to really, truly embrace the opportunity. But I think that the future world of healthcare will be, I think digital health will be prescribed as readily as drugs are. I also think there's going to be a combination approach moving forward, and that starts with research. So what we need to be doing now is researching what combinations work for which patients at what point in the pathway. So perfect example is mental health. We currently prescribe a lot of antidepressants out to people. Where could we potentially use a digital health intervention instead of a drug or alongside, and what's the impact? And a perfect example where we've seen a significant rise in need is around teenagers who are experiencing mental health conditions. And our capacity to deliver that care has always been lower than the demand, but it's never been more important that we're able to deploy solutions to support young people. And obviously from a drug perspective, most drugs are not licensed for younger communities. And so a very obvious place to start is around mental health for children and young people and deploying digital health technologies. But also what we need to learn is where does a combination of a drug and a digital health intervention or a digital therapeutics work to have a better health outcome. So another example would be medication adherence. Research is already showing that if you deploy a digital health technology alongside a drug, medication adherence and use is significantly increased, and therefore so is the health outcome from using that combination. So I think that the future world is going to be combination. I think that we need to really research in this area. I'm a real advocate for research that builds trust and confidence. But I do think that digital health and digital therapeutics are going to be being prescribed as readily as drugs are. Just one final point. What we need to be doing though is embedding the change in our education and in our curriculum for clinicians, not just from a doctor medical perspective, but also from a clinical perspective. We need to be embedding these new tools into education. It's absolutely critical, because if we don't know about these opportunities, we're not going to be able to deploy them to our patients.
That's so very true, Liz. Thank you so much for your time today. We've had a very interesting discussion around a variety of topics. We first covered the role of ORCHA and the importance that ORCHA plays in the digital health ecosystem, particularly in line with ensuring quality and safety of the applications and new technologies we're seeing in the healthcare space. We talked a little bit about the barriers to adoption, and you shared some insights from your journey with ORCHA on how we could overcome some of those barriers to adoption and ensure that digital health reaches those that need it most. And then we talked about the future of digital health and what role it could play in the future of healthcare. and how important it is to build blended ecosystems and blended healthcare pathways, and how important it is equally to educate our clinicians and our healthcare staff in order to drive the adoption, the utilization, the engagement, and the prescribing of digital health. I thought it was most interesting, Liz, when you said that digital health could play a role alongside, the pharmaceutical drugs being developed, and alongside as a support tool to increase adherence. And it would be great to see in the future how that plays out, and whether or not, pharmaceutical drugs as we know them today are as important as they are, or whether digital drugs become the new norm and the new game changer in the healthcare space. I guess my final question to you, Liz, is if you could describe your thoughts for the future of healthcare with one word, what would it be? How does the future of healthcare make you feel?
Oh, one word. I'm not really a one-word person, but how does it make me feel? As far as excited, the reason for that is because I can just see its applicability. And as a clinician, my drive was always I wanted to help people have access to healthcare. And actually what digital does is it allows us to deploy access to healthcare in a way which you can't do as a clinician, where you can only see one patient at a time. Actually, through digital health technologies, we've all bought the infrastructure in our mobile phones, and we can deploy a solution to millions of people all at the same time, and we're not compromised by our own individual capacity. So yes, excited.
That's really positive to hear, Liz. And I think equally, to echo your thoughts, I'm excited by what you've shared with us today, and more excited to bring some of the thoughts and the expertise you've shared into the Vitality ecosystem so that we can change how we deliver healthcare for our members. Thank you very much, Liz, for your time today. I'm Dr. Anushka Patchava. You've been watching Clinically Speaking, and thank you for your attention. Just so you know, we have a new episode on Clinically Speaking on our Vitality Advisor channel every month, and specifically, we have 3 parts in this series on the future of healthcare, and we look forward to welcoming you for both the other parts as well. Thank you very much.